So welcome to our virtual seminar entitled Using the PELI for Your Quality Assurance Performance Improvement Program. And this is Katie Abbott. I am at Miami University. I am an assistant professor of gerontology as well as a Scripps Gerontology Center Research Fellow. And I am delighted to be joined by Karen Ashragi. Karen is the project coordinator for quality improvement at the Madeline Abramson Center for Jewish Life in North Wales, Pennsylvania, which is a suburb of Philadelphia. Karen serves as a liaison for the Polisher Research Institute. Karen graduated from Temple University with her master's degree of social work. Karen has developed expertise in the development of reporting tools to empower clinical staff to improve the quality of care provided to the older adults under their care. She recently has participated in a variety of person-centered care initiatives, such as development of preference assessment tools, toolbox kit training materials, and preference congruence quality indicators. She is a sought-after presenter for both Leading Age and the Pioneer Network, and we are delighted to have her with us today. So as part of the objectives of our webinar, we hope that you will be able to understand the benefits of focusing on a QAPI initiative for meeting resident preferences. We hope that you'll learn how to establish a PIP, or a preference-focused performance improvement project, in your organization. And we hope that you'll receive guidance on how to utilize the Plan, Do, Study, Act continuous improvement method throughout your PIP. We always want to contextualize the virtual seminars that we provide by letting you know that this is part of a quarterly series that we host to disseminate findings from our research and collaboration with our stakeholders. We have several previous webinars that have been recorded and can be found on our website at preference-based-living.com. We have webinars such as integrating preferences into care planning, helping staff engage, and most recently, our webinar from last month was about honoring preferences when the choice involves risk. And so check those out in all your spare time, right? The recommendations we are presenting today are based on our experience and expertise of over 15 years of development, testing, and implementation of the PELI in various organizations. We seek to assist providers in practicing preference-based person-centered care assessment. And sorry about ignore the short stay, but we hope that you also recognize that this information is information that we have gleaned from many years of doing this work. It is not exhaustive, and of course, we encourage you to utilize your own experiences in these settings. All right, so we've unveiled our latest tip sheet, and you can download it from the website at preference-based-living.com and then look under Resources and Tip Sheets. And this is about a 9-page document, so it's a little bit longer than our normal tip sheets that we've released, but there was so much great information that we hope to walk you through this information today. If you have trouble locating it, just holler and we'll be able to send it to you. So, effective November 28, 2017, federal regulations require nursing homes to implement quality assurance performance improvement, or QAPI programs that take, and I quote, a systematic, comprehensive, data-driven approach, end quote, to improving quality of care and quality of life for residents. So as I mentioned, this tip sheet will outline how to use the scientifically validated Preferences for Everyday Living Inventory, or PELI for short, tool as the basis for a QAPI project that can increase your community's responsiveness to resident preferences and promote person-centered care. So one thing we are going to highlight is that this work must be supported by the senior management team at your organization. What our experiences has led us to believe and see is that without the support of your senior leadership, this kind of a quality improvement, performance improvement project cannot be possible. All right, so why should you focus your QAPI on preferences? Using the PELI will help your community honor individual preferences as well as empower residents, promote their meaningful engagement in daily life, and enhance psychosocial well-being. And we see these benefits in several important ways. So first, we see it among staff members. So staff who know a person's preferences can understand and anticipate resident needs, become more trusted and responsive caregivers, and work more efficiently together. Communities can gain referrals from residents and families who have had satisfying experiences. Recording and sharing positive feedback can be a powerful marketing strategy and help your community stand out as a quality provider to consumers. Staff retention, job satisfaction, and morale may improve due to strong relationships between staff and residents. Using the PELI to assess preferences and integrate them into resident care plans enhances compliance with federal regulatory guidelines and incentives for person-centered care in some states like Ohio. And so what happens in a QAPI project focused on preferences and person-centered care? So in this instance, team members in your community learn how to use the PELI to assess resident preferences routinely, to integrate the information gained from your assessments to craft more personalized and successful resident care plans. Tracking and documenting progress to assure that assessments and care plans are carried out consistently and effectively are another component of the QAPI. And also assuring continued emphasis on preference fulfillment and resident satisfaction as part of daily practice across shifts can be supported. So how this particular set of tip sheets are organized. So the first page provides advice about how to get started in establishing a preference-focused performance improvement project, or PIP, as part of your QAPI program. And then the subsequent tip sheets offer guidance for each stage of the initiative based on the Plan, Do, Study, Act, continuous quality improvement cycle or method that's recommended by the Centers for Medicare and Medicaid Services. The detailed tip sheets in the series show how to start your PELI-PIP and implement a strengths, weaknesses, opportunities, and threat analysis, or SWOT analysis, in order to understand your community's current strengths and weaknesses when it comes to assessing and fulfilling resident preferences. It also walks you through developing and launching a plan for change through a PIP, using audit tools to study, track, and achieve improvement goals, and also to refine approaches and support a sustainable process for continuous improvement. So fantastic. You've made the commitment to prioritize preference-based assessment and services as part of your community's QAPI program. And so starting on the road to success by assuring that you have the top management support, as we've mentioned, but also by establishing a PELI-PIP committee and becoming familiar with the concepts of preference assessment and fulfillment. So to begin with, your community, as I've mentioned, will need top management support and a strong vision for culture change towards person-centered care. We can't emphasize this enough. In every instance where this initiative has failed, it has been because there has not been top management support. We also see success where there is a collaborative problem-solving culture, where there's respect and positive communication shown. There is also the need for resources, such as time for staff across shifts to participate in committee meetings, collect and analyze data, and conduct resident assessments and care planning activities. And also there's a need for training and development to use these QAPI approaches. So the next step is to select your champions and team members. Now, we encourage you strongly to include individuals who work in departments all across your organization, and including departments that may not typically be represented. So We would probably all think of social services as being a part of a PELI-PIP, but also therapeutic recreation or life enrichment, dining services, nursing, chaplaincy, therapy, community coordination, even maintenance and housekeeping. We've found in our research that maintenance and housekeeping staff are central to providing person-centered care, and so don't forget about those important individuals. Also, think about including individuals from departments that are in staff development and even physician services. Be sure to include a representative of top management who can help to overcome barriers and secure resources that are as needed. You may also include direct caregivers with first-hand understanding of the rewards and challenges involved in honoring resident preferences. Finally, include residents and family members in your PELI-PIP committee. And we know that there are some challenges to doing this, but having them give voice from their perspective is vital to the success of these programs. We see champions or task force members that are successful being passionate about honoring resident preference and choice, being able to serve as effective advocates and have potential for leadership abilities, working closely with employees and or volunteers who conduct resident interviews would be another good aspect. If they're willing to identify areas of weakness, if they're eager to seek continuing education opportunities, and so you might also involve one or more members who can develop and use tracking systems such as spreadsheets like Excel, even Word that can track things. Take time once you have your PELI-PIP committee together to educate and familiarize your committee with the PELI and the concept of preference fulfillment. Consider some of the resources that we have on our website. We have a variety of videos. We have a 3-minute Why Preferences Matter animated video that can set the stage. We have many tip sheets on how to get started, and interviewing tip sheets, as well as we have a 22-minute training video on how to interview older adults using the PELI. And so utilize and sort of go through the resources that are on the website that are for free. And then also consider working together. So interviewing one another as practice so you can see how things, how responses work, how it's helpful if the words can roll off your tongue as you're doing an interview. You might also consider observing community life and activities such as dining or recreation to gain insight into the resident and family experience when it comes to preference fulfillment. Discuss the importance of honoring preferences with residents, family, and staff. And then as you start your work, and then on an ongoing basis, record your PELI-PIP committee's activities. The information you collect will allow you to track, evaluate, and celebrate your progress, as well as report to your community's leadership and resident and family committees. And you can also show surveyors the work that has been done to promote your community's ability to address preferences and incorporate them into each resident's care plan and daily life. Okay, so now the next few pages of the tip sheets walk us through the quality improvement process using this plan, do, study, and act cycle. And you can see the diagram here where we have illustrated some of the steps in each of these segments. This tip sheet contains practical implementation details that will help your team move ahead as you're ready for each step in the cycle. So the first stage, during your plan stage of the PDSA, your committee needs to learn about and understand your organization's vision and strategic priorities. The next step is to identify the current state of your community's capability to assess, communicate, and honor resident preferences. Do you have a process in place to focus on customer preferences? If so, what processes do you follow? We're also going to suggest a SWOT analysis to identify your strengths, weaknesses, opportunities, threats, and challenges. And these are some examples of questions that you could go through with your committee. You can utilize the SWOT analysis questions here to identify your current state, as well as to anticipate the factors that might make it easy or challenging to improve preference fulfillment. By conducting simple interviews and some basic research, the committee can create a picture of your community's starting point and develop realistic plans for change. Okay, so based on results from your SWOT analysis, next it's time to develop a plan. Perhaps this is an outline form that addresses the goals, structure, communications, training, staffing, reporting, and commitment. The plan should consider these key questions. So for example, what is the goal that you are trying to accomplish? Ideally, set a timeline and specific milestones. Which preferences and target population will you focus on? Starting with a simpler focus, a smaller neighborhood perhaps, will give you practice and is likely to yield success that you can build on in subsequent, more complex PIPs. Perhaps you start with individuals who are cognitively capable to be interviewed, and then you can build your capacity to start to assess preferences for individuals who have more difficulty communicating. How do you envision the new process or practices? Who will test the new practice? How will you share individual preference information across care team members? How will you communicate the initiatives of the PIP throughout the community? Which care team members and departments will be involved, and what roles will they play? What training will be needed for interviewers and care team members? And how will you determine whether the new approach is working? What data do you need to collect? Do you have a commitment from committee members to do their homework in between meetings, as well as, you guessed it, support from top leadership to support the initiative? Okay, so next we go into implementing the plan, or the do stage. So after you have your PIP plan in place, pilot test your change, possibly on a small scale. It might be one neighborhood of your organization. As the pilot work unfolds, track problems or barriers that arise so you can analyze and solve them in step 4. Your do steps could include training staff members and volunteers to conduct PELI interviews, and again, see some of the resources that we have on our website. Conducting PELI assessments and collaborating with an interdisciplinary care team to incorporate preference information into care plans could be a next step. Communicating resident preferences across all team members and shifts involved in a resident's daily life and care is another piece of the plan. Next, we have the study phase. And the purpose of the study phase is to measure your organization's progress in using new practices to reach preference assessment and fulfillment goals. With data in hand, your team can reflect on whether your new processes need further refinement. Choose among the measurement approaches that we have listed here, or consider using another system that works well in your community. So, for example, you could track how consistently PELI assessments occur in your community. You can also create an audit tool to collect more detailed data, such as whether care plans incorporate important preferences. More advanced web-based tools measure resident satisfaction with the way preferences are fulfilled. And some of these tools that we have on our website one is called Compass, which is the Care Preference Assessment of Satisfaction. It's a mobile responsive website that can help you with assessing and tracking satisfaction. You also could use other online tools for benchmarking across your community. And so another option is to, whichever measure strategy you choose, your team should review the data and reflect on improvement processes that work successfully and those that require further attention. When you uncover implementation problems that are difficult to fix, think about a root cause analysis, which can provide a practical way to explore the underlying reasons for the problem. The Centers for Medicare and Medicaid Services provides free resources on guidance for performing root cause analysis. And so again, that link is on the tip sheet for you to access if you need it. And then finally, you want to report your committee's findings to your stakeholders that include your community's QAPI committee, organizational leadership, surveyors, and resident and family councils. and be sure to celebrate and reward success to keep up the momentum. We can't stress again how important it is to celebrate those successes. This helps make this seem less like work. All right, and the final stage is the ACT. And this is where sustaining processes come into play. So maintaining focus and ensuring that new practices become part of everyday care can be challenging. After pilot testing a new process, your team may be tempted to rest on its laurels. But the Plan, Do, Study, Act cycle provides natural next steps to keep your improvements going and expanding. The ACT phase focuses on two types of activities. First, assuring that successful new preference assessment and fulfillment practices become, quote, the new normal, end quote, and a standard part of daily care. So building on your learning from your first pilot test by setting new priorities and a timetable for the next phase of preference-based care quality improvement. So some tips for sustainability. To make sure that your new process become routine throughout your community, you could document the new PELI practices that will become part of your community's standard operating procedures. Imagine that you are explaining exactly who will carry out each step as new residents join your community and what each step consists of. As simply and directly as possible, explain to staff, residents, and families why it makes sense to adopt the practice change widely. Use findings from your pilot test to show the benefits of the change for the people you serve and the doability for staff. As needed, add new responsibilities to job descriptions for staff coming on board and and to let their supervisors know. Consider changes in recruitment to assure that newly hired staff members have the qualities necessary for a culture of preference-based care. And a few last tips for sustainability here. Revise your staff training programs to include new preference assessment or preference fulfillment practices. You can establish a method and timetable to monitor whether the desired steps are carried out. Decide whether supervisors will assume this responsibility. You can also review documentation in individual records and use audit trails, as I've mentioned, for quality assurance. And develop a plan to recognize team members who are preference ambassadors or champions. Consider an award ceremony, perhaps organized according to a special theme. And the ACT phase presents an opportunity to solidify new pilot-tested practices that improve staff understanding of each person's preferences and reinforce for residents that their voices and their wishes are heard and respected. Your team can then turn to the next set of preference-based person-centered care improvement priorities by starting the Plan, Do, Study, Act cycle again. And so growing your community's commitment to preference-based care by identifying a new PELI-PIP. And so there are different things you could do at this stage. You could extend these new practices to another neighborhood, to a different program or target population. For example, you might have started with residents who are cognitively capable, and maybe you move it into those that have cognitive impairment. You might select another area in your organization that your residents have said needs attention. So for example, in Ohio, the Department of Aging Nursing Home Resident Satisfaction Survey results could be used to identify opportunities for improvement. So for example, we know that meals and dining are something that has a lot of feedback from residents. And there are 6 PELI items about food preferences, and that could offer the basis for a PELI-PIP focused on improving meal and dining satisfaction. In addition, you could assure that care plans always incorporate the individual's important preferences for daily life, and you could benchmark resident satisfaction levels with other organizations measuring your preference fulfillment. So just some examples there. So in terms of the next steps, assure that care plans always incorporate the individual's important preferences for daily life. And as we've mentioned, you could have some audit tools where you systematically pull a few care plans and read through those with the PELI side by side to see if important preferences are incorporated. And you can benchmark resident satisfaction levels with other organizations measuring preference fulfillment. Okay, so at this point, I am going to turn it over to my co-host, Karen Ashiragi, who's going to walk us through a sample PELI-PIP worksheet. So, Karen, take it away.
Great. Thank you so much, Katie, and I'm just delighted to be here this afternoon with you all to share our community's experience with implementing the PIP for preference assessment. So as Katie has mentioned, this sample PELI worksheet, which you see here, really helps guiding your team to strategize where to start with implementing the PELI. The Plan, Do, Study, Act really assists with helping the structured decision-making process for implementing change. In this next section, we're going to go over the components of this PELI worksheet. I'm going to reflect on the experience of our care community's efforts to enhance the experience of our new residents transitioning into the nursing home. So our goal was to be able to enhance the process of our direct care staff having access to important preference information, such as when a resident likes to get up in the morning, what kind of routines they like to follow in the morning, when they want to choose to eat, when to nap, and, doing favorite activities. Those are just a few. Next slide, please. Next slide, please. So in the plan, you're briefly describing the change you're planning. What are you wanting to accomplish? So in this stage, you're assembling a committee that's really going to be developing a practical working plan to assess resident preferences using the Preferences for Everyday Living inventory, as well as thinking about how to integrate these preferences into care plans. So the change that we focused on was, in preparing for the CMS Focused Dementia Survey process, we wanted to review how we capture preference information in our pre-admission and admission process regarding specific care needs of residents with dementia. In the Dementia Focused Practice Area Worksheet, the PELI is referred as an instrument that can be utilized as a preference assessment tool for learning about previous life patterns, choices, cultural patterns, and preferences with respect to daily routines. Therefore, we assembled a team of admissions, recreation, administration, nursing, IT, and quality improvement to really review how we were going to assess how well we were doing in the pre-admission process. Next slide, please. So in this planning phase also, you're going to be predicting what do you think is going to happen? Why are you going to go about doing this? So in this stage, you're going to be learning about, why preference-based care, why that's such a core element of person-centered care. You're going to be reviewing published material and videos on preference-based care. You're going to really be learning about the nuances of the PELI-PIP preference assessment instrument and how it captures all aspects of daily care of the residents. You're going to be, looking to analyze how well your community is currently assessing and honoring preferences, and then you're going to be developing a specific plan for a pilot test. So in this planning phase, we determined that we needed to focus our efforts at improving how we capture information prior to when a resident arrives to our home. We predicted that by having this information, that would assist our nursing care team to better anticipate the residents' needs and help them with transitioning to the nursing home. So we analyzed that one of the strengths of our organization was that after a person arrives to the nursing home, our recreation department does a great job interviewing residents, finding about their recreation preferences. The recreation team, they're capturing great information about the leisure and activity preferences, and they've developed the recreation portfolio based on most important patterns of recreation preferences. So our specific plan was to focus on learning more about the daily care preferences prior to the residents coming into our nursing home. So we developed an emotional well-being and preference inventory that would be included in the admission packet prior to a resident arriving to the center. We were asking families to complete this information ahead of time so that the care team would be able to incorporate the information into a personalized plan of care. So what we did is we reviewed the preferences for everyday living inventory, and we selected 10 preference items that we put into this survey to be provided to the family, prior to the resident's admission. Next, please, page, please. So in this planning section, what data do you need to test your predictions? How are you going to collect this data? So here, you're going to document your team reports. They're going to list the specific steps for the pilot test. They're going to use new practices to improve preference assessment and fulfillment. And then also you're going to be submitting your plan for approval to the Community QAPI Committee and Leadership for the initial implementation. So some of the data that we were looking at to test our prediction was to see how well the families embrace completing this information. So we were looking at the rate of completion. By tracking the rate of completion, we were able to brainstorm when we came across obstacles to completion. For example, we found that our response rate was great if the resident was transitioning directly from home, but it was more sporadically completed if a person transitioned from our transitional care unit to our skilled unit. In those instances, we had to seek assistance from staff to gather that information. We also wanted to get feedback from the direct care team in our pilot if indeed having this information was helpful. So we conducted many interviews to staff to see how effective was the process. We got a lot of positive feedback from the care team that this was so helpful to know this information without the staff having to look through the chart or having multiple people ask the same information. Next slide, please. So in this planning step, you're looking through all the tasks to be done. You're determining who's going to be responsible for what. You're going to be identifying a champion who's going to help keep all the moving pieces moving. And then, again, you're going to be really looking at your committee membership. You're going to be looking to ensure that you have membership on your committee from different departments. So in our particular project, we identified a champion who assisted with all aspects of the pilot. We included in our plan the role and responsibility for each department for relaying the information. For example, the admissions department included the emotional well-being and preference inventory in the packet, in the new admission packet. Once they received that information back, they scanned it into the file, and then they notified the interdisciplinary team. From there, our recreation team gathered the information, and they input it into our electronic medical record. And then once we had that information inputted into our medical record, then we transformed it into a one-page all about me documented. And then we had to go through, making sure that the document was edited for HIPAA compliance. In this one-page document, we included topics such as stressors and ideas for relaxation, daily patterns or routines, food choices, and hobbies and interests. And all this information we got from this emotional well-being imagery that was completed by the family. So one very important team member that we included in our PIP was our IT team, because they were instrumental in helping us to build the PELI assessment tools into our medical record. And then what we did is all of the information that was collected about the different residents, we put it into a binder on each household so that the staff were able to reference back this information. So this information was then able to assist the care team for care planning or for other purposes such as mood and behavior rounds. Next slide, please. So in this component of the plan, you're going to, really be thinking through, the agendas for each of the meetings and, really making sure that all of the tasks are being completed and, really looking at gathering resources to educate the team along the process. Throughout the process, doing your SWOT analysis to understand, the next steps. What are your strengths, your weaknesses, your opportunities and threats, and your preference fulfillment in your community. Having the SWOT analysis or the root cause analysis is integral to really ensuring that, the project is moving forward. So when we first implemented the process, we met regularly to assist with resource development and to educate relevant departments on the purpose and scope of the project. Our SWOT analysis helped our team to think about what was working well with the process and what were the areas that we needed to be enhanced upon. So, for example, some of the areas that we had to develop strategies were ensuring that our binder information was kept up to date. We then had to implement regular audits to ensure that old information was properly shredded. Also, we needed to put audits in place to ensure that the preference assessment information that was being captured, through this information provided by the families was being captured into the care plan and that we were honoring the resident preferences. So a very important strength that we discovered is that the family was providing excellent tips to assist us with, with knowing about their loved one's emotional well-being. The information was really helpful for our direct care staff to think about non-pharmacological behavioral interventions that could be utilized when an individual expresses distress. We were learning about triggers, specific events that may precipitate distress, or what the family has been done by the family to help their loved one feel better. So what we realized is that we needed to find a way to channel that information into the resident summary so that the direct care team could learn from the family. So we consulted again with our IT team, who helped us come up with a solution to streamline the information from the All About Me to our resident summary, so that information was readily available for our care team. Next slide, please. So again, using the SWOT analysis, a structured, process to help, looking at your strengths and weaknesses. So based on, looking at those results, drafting a work plan that can help you think about specific and measurable aims. What is the target population that you're going to focus on? What are you hoping to change in your practice? And then what methods for testing and, for delineating the roles of the staff members involved, and what data collection is going to be leveraged to really help you determine whether the change that you're anticipating is going to have the desired effect. So from our team perspective, our plan was very developmental. And based on the learnings, of what worked well and what didn't, we were able, to drive change. We found that being flexible and working together to overcome obstacles was really instrumental in moving the project forward. Next slide, please. So here in the do, you're going to, really look to evaluate whether the plan was carried out. Again, looking at those successes, what are the successes that you encountered? That is so important to really, engaging staff and motivating, when you really focus on, the successes you've garnered. So here, after learning about the PELI and the importance of assessing resident preferences, the team crafted a plan to improve timeliness of PELI interviews, as well as the frequency for which resident preferences for wake-up times are honored. The team is excited about implementing the plan and knows challenges are ahead. So here, from our experience, we really learned, again, to review what is working well and to highlight successes. We learned that the information that is gleaned in the preference interviews not only helps with honoring preferences on an individual level, but it really helps us think about developing schedules on the household or unit based on patterns of preferences for daily routine, such as schedules for waking up, bathing, going to sleep. It's a real shift away from having facility-driven schedules and thinking about having more person-centered schedules. Next slide, please. So again, in the do, you're looking about what problems or unexpected events did you encounter. Here, we experienced no significant problems during this phase, largely because our senior management fully endorsed our committee's work, and staff felt empowered to devote time to this important project. Top leadership will help us communicate the next phase of our PDSA effort, pilot testing the project on one neighborhood of our community. Again, cannot emphasize enough, having senior administration support is really critical, for the buy-in for the project, for staff, helping staff think about creative ways of, resolving obstacles, thinking about needed resources, that sort of thing. Next slide, please. So along the way, gathering feedback and observations from the participants can really help with your developmental efforts. It helps you to think about tweaking your plans and really ensuring the plan is relevant to the specific needs of your organization. As I mentioned, in this particular project, we focused, because we were doing our interviews for the recreation preferences, which are 34 preferences of the PELI assessment. We really focused in this particular project, looking at the 10 daily routine preferences prior to admission, and then asking the recreation preferences within the first month. Next slide, please. So using the data to help inform you is, truly, the benefit of having the structured PIP. Leveraging, a data-driven approach can help your team to really focus on opportunities. So in this particular example here, the data showed through the SWOT analysis that the PELI assessments for new residents should be completed the SWOT analysis showed that not completing the PELI assessment, excuse me, let me say that one more time. Let me get a drink of water. So studying results assists with helping the team to learn about the impact of the pilot and developing next steps. So in this particular example, the SWOT analysis showed that we are not completing PELI assessments for new residents as soon as would be beneficial. So residents would like to have more flexibility with wake-up times. Staff, as well as resident and family representatives, are enthusiastic about capturing resident preferences and honoring them more consistently. Here, the group held 3 meetings and successfully created an action plan for the next PELI-PIP, and then the leadership of the organization approved the plan. Next slide, please. So what's so important is that the process takes time and commitment, but believing that it will yield important outcomes for the community is essential to keeping people focused on why you're doing this particular PIP. So in our particular project, we learned that the direct care staff felt empowered to build relationships with the residents that they were caring for. Another great outcome that we had is that having the All About Me binders available on the households assisted with communication so that all team members could get to know what is important to the resident. For example, a doctor wanted to know a few tidbits to assist with striking up a conversation, would have access to that information, or if the caregiver wanted to know approaches to how to care for that resident. Next slide, please. So here, what you're going to be looking at is you're going to be looking at, with your next steps, are you going to continue to adopt the new steps? Are you going to need to adapt, or are you going to abandon the change? So this is helping with the sustaining of the project. So based on the success of your planning effort, you're ready to begin a new PDS cycle aimed at improving ability to complete PELI assessments within 21 days of a resident's move-in date. And then you're going to be looking at meeting resident preferences for morning wake-up time more consistently. Next slide, please.
And then, as we've mentioned, we really seek to create opportunities for providers to interact and learn from one another by sharing successes and stumbles. So, for example, working with the Abramson Center for Jewish Life has helped us learn more about the quality improvement process and to be able to share it with other organizations. We would be honored to hear about your, your triumphs, also your struggles, and we'd be honored to visit with you. We're interested in learning how you've implemented the PELI and barriers and facilitators that you've encountered. So reach out to Alex if you have any questions, as well as setting up a time for us to come visit. We have a monthly newsletter, as I mentioned. If you don't receive it, please sign up. Again, Alex will also pop that link into the chat box for you to click on and go to. We only send out one newsletter per month, we promise, and we also never share information. We never share our contact lists. And so please do sign up for our newsletter. And then, as I've mentioned, we have more resources on our website, and we also have a helpline. So, reach out to us and let us know if you have any questions, and we are happy to support your efforts. And if we don't know the answer, we have a group of individuals that we can reach out to find answers to. And so at this point, we want to thank you and start to answer some questions. So there's one that I have for you, Karen, and then maybe Alex can pop on and ask some of the other questions that we have. But so Karen, what kind of resistance might you encounter to quality improvement, and how do you sort of bring people around, I guess, for lack of a better term, towards sort of supporting your quality improvement efforts?
That's a great question. I mean, I think what is so important is, really, having opportunities to consult together and to, really, have a unified vision in terms of, why a particular area, is important. Definitely having data to support why you're focusing on a particular area really helps staff to understand, the critical nature of why a particular area has to be focused on. I think having the senior management, having their buy-in is super important, and that, that the project is relevant. It has to be relevant and for people to understand, why you're doing it, and, and for them to anticipate what the benefits could be. And I think that, through that process, staff get engaged, and it's all, it's also really important to motivate staff and for them to, have, some sort of encouragement, for participating.
Great, thank you. And we have another question. Are you able to share a blank form that you implemented for the All About Me binder?
Absolutely.
So they're interested in seeing the process that has been put into place as you discussed. So if that's something that you can share, we can send it. Fantastic. So what we'll do is we will share it with those attendees of the webinar, so we should have your email addresses and can forward that to you. That's a great.
Yeah, that's a great question. So what I can do is I can send the questionnaire. We have a number of questions that we ask about emotional well-being. Some of the questions, for the emotional well-being are, describe what brings joy or pleasure to your loved one in a typical day. What are some of the ways that we can assist your loved one to feel comfortable in their new home? So it has a series of emotional well-being questions, and then it has 10 preference items directly from the PELI, focusing on the daily, preferences, for the morning, for the evening time, food preferences, that sort of thing. So I can send both this questionnaire and then what the template one-page sheet looks like.
That would be great, and we will share that with the attendees of the webinar, and then potentially we can put it up on the website too. That's great information. And so, Karen, how do you prioritize? Last question, and then I know we've got to wrap it up here. But how do you all prioritize what QAPI efforts or PIP efforts you will do? Obviously, there's hundreds that you could choose from.
Absolutely.
So what's the process, or how do you all decide which ones to focus on?
That's an excellent question. Obviously, performance improvement areas that are related to, regulations or, related to quality measures, those, bubble to the top. But the way that I like to think about it is I really like to think about how does having this preference information help us with an important quality of measure PIP. If we're looking to reduce pressure wounds, or we're looking for falls prevention, how is having information about those preferences, how can we leverage that information to help us, with these other important clinical areas?
That's fantastic. Thank you so much, Karen. This has been fantastic, and I think we could probably go on and on with this. But again, we wanted this webinar just to sort of whet your appetite for thinking about QAPI and PIPs related to preferences and specifically related to your use of the PELI. And again, I want to thank Karen Ashragi from the Madeline Abramson Center for Jewish Life for joining us, and we hope that you all have a great rest of your day. Thanks, everybody.
Thank you so much, Katie.
Okay, bye-bye.